Hello, my name is Jasmine LaSalle. I'm a family nurse practitioner student with Simmons University, and today I'm going to be talking about bronchiolitis. What is bronchiolitis? Bronchiolitis is a lung infection commonly affecting children under 2 years of age. It is mainly caused by a virus called RSV. The symptoms include mild to moderate respiratory distress. While it's primarily a mild infection, it can sometimes lead to respiratory failure in infants. Unfortunately, infants tend to have the most severe symptoms. Pathophysiology. So what's happening in your baby's lung when they have bronchiolitis? Bronchiolitis causes a lot of inflammation in the lining, meaning the wall of the small airways. This inflammation can cause a lot of mucus production and narrowing of the airway. As a result, your baby may experience wheezing, coughing, and difficulty breathing. Bronchiolitis can get very severe as it diminishes the lung's ability to expand and recoil, and it requires immediate medical attention. And here's a picture to help you visualize where the bronchioles are at inside the lungs. So they're just right here at the very end. The bronchioles transport air to small sacs in your lungs called alveoli. So it's very important that we keep them clear of any secretions and inflammation. Signs and symptoms that indicates that your baby may have bronchiolitis: cough, fatigue, fever, using abdominal muscles around the ribs to breathe in, nostril getting wide when breathing, rapid breathing, wheezing and shortness of breath, bluish skin, lips, fingernails due to lack of oxygen, and this requires emergency treatment. Here's how your doctor will be evaluating and diagnosing your baby with bronchiolitis. They will obtain a thorough history, and based on the clinical symptoms, they can make the diagnosis. They can also order a rapid diagnostic assay to identify the virus. They may perform checks, X-ray, and blood gases if they suspect that there are any complications. And any children with a fever of unknown source will get a urine culture, as it's very common to have UTI in children with bronchiolitis. Evidence-based interventions. Provider must assess the adequacy of hydration, assess for respiratory distress and the presence of hypoxia. Children with mild to moderate symptoms can be treated with nasal saline, antipyretics, and cold mist humidifier. However, those children with severe symptoms of acute respiratory distress, hypoxia, and dehydration should be admitted and monitored. These children need aggressive hydration, humidified oxygen, and nebulized hypertonic saline. It is essential to maintain adequate hydration and oxygenation, and any children experiencing severe respiratory distress may progress to respiratory failure. Therefore, they may require mechanical ventilation and non-invasive support, such as a high-flow nasal cannula. Here are some tips to manage your children at home. To help your child with a stuffy nose and breathing difficulties, give them plenty of fluids and ensure they rest well. Use a humidifier to moisten the air and give saline nose drops with a nasal suction. Avoid smoking around your child. Please note that hospital treatment, including oxygen therapy and IV fluids, may be necessary in severe cases. Here are some tips for successful treatment and to keep your child safe. Proper infant positioning should be ensured to avoid suffocation and any discomfort. Evidence shows that prone position is safe during bronchiolitis. Manage fever with Tylenol or ibuprofen. Avoid using aspirin. Keep a cool home environment. This will facilitate breathing. Maintain adequate hydration with water, juice, milk, or Pedialyte. Avoid tobacco, smoke in the house, and any other irritants. Frequent hand washing and complying with the medications as prescribed by the doctor. Here's some symptoms that requires immediate medical attention. Blue or gray skin, lips, or fingernails due to low oxygen levels, difficulty breathing, inability to speak or cry, refusal to drink fluids, rapid breathing that makes eating or drinking very difficult, breathing very fast, especially in children, difficulty breathing with visible inward movement of the ribs during inhalation, wheezing sounds while breathing, grunting noises with each breath, sluggishness, weakness, or extreme fatigue. Please know that even though the prognosis of bronchiolitis is good, it is a self-limited viral infection. If not adequately managed, if the patient is not well hydrated, if fever is not controlled, it may progress to a severe infection and worsening of the symptoms. Here's some tips to prevent bronchiolitis in your baby. So limit contact with people who have fever or cold, especially if you have a newborn or a premature baby. Clean and disinfect any surfaces that people frequently touch, especially if there's any sick family member. Wash your hands often and use a hand sanitizer with 60% alcohol when you're away from home. Have good cough etiquette. Don't share your drinking glass, especially if there's anyone ill in your house. Breastfeed your baby whenever possible, as respiratory infections are less common in breastfed babies. Also, RSV can be prevented by the RSV vaccine. So there's one vaccine that can be given while the woman is pregnant between 32 to 36 weeks of pregnancy. And there's also another vaccine that can be given to infants aged 8 months and younger born during or entering their first RSV season. One dose of nirsevimab for infants and children aged 8 to 19 months who are at increased risk for severe RSV disease. And children who are at high risk are those with lung conditions, cardiac conditions, and premature babies. And here's some important resources for you to reinforce your knowledge. You can go to the CDC website and find the respiratory virus guidance snapshot. So you have very good written information, and also you have visuals like the one that I'm showing in here that will give you insights about immunizations, hygiene, steps to maintain cleaner air treatment, and other things that you can do to prevent any respiratory infection. Also, there is some specific information in the CDC website for RSV in infants and young children. Also, you may refer to the American Lung Association that has very good information about RSV, how to prevent it, and how to treat it. Here are my references. Thank you.